Hello and welcome to all of our alumni of the University of Michigan. I am Haley Briggs, and I am the Senior Associate Director of Alumni Lifelong Learning. Thank you to everyone for joining us this evening as we wait for some of our attendees to join. I'm just going to cover a few housekeeping notes before we get started, and we do have a poll question launched that we invite you to answer. This is an interactive webinar that is being recorded. A link to the recording will be posted to the main Alum 101 course page, along with additional learning resources tomorrow, hopefully by the afternoon. We can only control so much of your screen, so please feel free to make adjustments to your view using the screen separator and enable the closed captioning, and both of those can be found at the bottom of your toolbar. The chat feature is also active, and we hope you will participate in the discussion with other participants throughout the session. To do so, we just want to note that you should select everyone when typing any comments in the chat so that we can all see what you have to say. And because the chat section will be so active, please be sure to submit your questions for our speakers through the Q&A feature in your toolbar. After the lectures, we're going to do our very best to get to your questions, but it's possible we may not get to all of them. You can also upvote questions by liking them, and that helps us prioritize questions during the Q&A time. So last class, we touched on chronotypes. So to kick us off in the chat section today, let us know if you think you are a morning lark, a night owl, or somewhere in between. And you can also share where you're joining us from because I always love to see that. And I'm here today in Ann Arbor, Michigan with my colleagues Kiara Trotter, our Director of Alumni Career and Lifelong Learning Programs, and Brooklyn Posler, our Senior Associate Director of our Alumni Career Program. So that opening poll question is live. Please feel free to take a stab at answering it. And I'm happy to be online with you all and would like to welcome back everyone who joined us for our first class last week. We are very excited and very grateful to have Dr. Greta Ragland and Dr. Todd Arnott with us this evening to explore the foundations of healthy sleep. So I'm going to share a little bit more about our presenters. Dr. Greta Ragland serves as clinical psychologist and clinical associate professor of psychiatry at Michigan Medicine. She holds a diplomate in behavioral sleep medicine from the Society of Behavioral Sleep Medicine and a certificate in perinatal mental health from Postpartum Support International. She specializes in perinatal sleep and mental health research. In her clinical practice, Dr. Ragland provides care to patients at the Multidisciplinary Sleep Disorders Center at Michigan Medicine, as well as in the Perinatal and Reproductive Mental Health Clinic. Her research primarily focuses on employing sleep-based interventions to enhance mental health outcomes, particularly for perinatal populations. Dr. Todd Arnott is a professor of psychiatry and neurology, director of the accredited behavioral sleep medicine program, and co-director of the Sleep and Circadian Research Laboratory at Michigan Medicine. He is also a diplomate in behavioral sleep medicine and provides clinical care to patients in the Multidisciplinary Sleep Disorder Center. Dr. Arnott conducts research on sleep and circadian rhythms and mental health disorders with a specific focus on substance use disorders, and his research has received funding from the National Institute on Alcohol Abuse and Alcoholism, National Institute on Drug Abuse, and the National Institute of Mental Health. Dr. Arnott also serves on the editorial boards for several sleep-related academic journals and has served in leadership roles for both the American Academy of Sleep Medicine and Sleep Research Society. So with that, I'm going to turn it over to Dr. Arnott to kick us off and to answer our poll question. So I'm going to go ahead and share those results now with everyone.
Thank you, Haley, and welcome everybody. I'm waiting. Is this the final tally for our poll?
Yes, this should be it.
Okay. So the question that we posed in the poll was, what effect does light exposure at night have on the sleep process? And the correct answer, as was guessed by 84% of you, was that it inhibits melatonin release. So melatonin is a critical hormone, helps us sleep at nighttime, and light is our enemy at nighttime. So light actually will inhibit melatonin release and can interfere with the sleep process. You'll hear a little bit more about that later from my colleague, Dr. Ragland. So I'm Dr. Arnott. It's a pleasure for me to be here today, along with my colleague, Dr. Ragland. We're going to talk about the foundations of healthy sleep. Last week, I know you learned about the science of sleep and circadian rhythms from our colleagues, Drs. Shelgakar and Swanson. And tonight, we're going to build on that foundation to discuss healthy sleep a little more specifically, and at the end, leave you with some concrete strategies for promoting healthy sleep in your everyday life. Dr. Ragland and I have three broad learning goals for today's presentation. First, I'm going to start by reviewing the main concepts associated with healthy sleep and highlight why they're important. Then I'm going to speak briefly for a few minutes about some of the primary implications if you don't pay attention to those and you obtain unhealthy sleep. And then finally, Dr. Radigan's going to leave us on a high note and talk to you about specific strategies that you can follow to help you consistently get healthy sleep. So I want to start first by acknowledging the benefits and really the power of healthy sleep. Sleep is a fundamental pillar of our health, and it's critical to all aspects of our physical and mental well-being. The benefits of healthy sleep are really innumerable, but among the main benefits are that it helps to heal and repair cells, tissues, and blood vessels. It allows us to have a stronger immune system. It makes us more creative and productive. It helps to improve our mood and energy. It allows us to have better brain functions, including things like alertness, decision-making, focus, learning, and others. It allows for our kids and teens to grow healthfully and develop properly. It allows us to have a better ability to build muscle, to have quicker reflexes, and finally, it puts us at less risk of chronic disease. So sleep really is powerful. But what goes on when we're sleeping that contributes to our overall health? Well, I think as you heard at least a little bit last week, let's start with some of the fundamentals. There are two states of sleep: non-rapid eye movement, also called non-REM sleep, and rapid eye movement, or REM sleep. And you can think of these really as the building blocks of healthy sleep. Non-REM sleep makes up the majority of our sleep, about 75% of the night, and it can be further broken down into different stages. These stages are determined based on different physiological parameters that we measure, typically when people come visit us in the lab and we have them stay overnight. And the main parameters that tell us about sleep stages include the EEG, or the electroencephalogram, which measures brainwave activity, the EOG, or electrooculogram, that measures eye movement activity, and the EMG, or muscle movement activity, which is also called the electromyogram. And as you can see from the figure I'm showing you here, the stages 1 through 4, which are actually now called stages N1, N2, and N3, they increase in both the depth of sleep and the synchrony of the EEG as you go from stage 1 through 4. So stage N1, which makes up about 5% of a typical night of sleep, that's a very light stage of sleep. And the EEG associated with this stage, you can see, is small in amplitude and relatively fast in frequency. By contrast, at the other end of the spectrum, stage N3, which makes up about 10 to 20% of healthy sleep, this is a very deep stage of sleep. And the EEG, by contrast, is highly synchronous, as you can see from these pictures. And that means the amplitudes of the waves are quite large, and you can see the frequency is relatively slow. Stage 2, which actually makes up the majority of our night, about half the night of sleep, it's actually somewhere in the middle in terms of both depth of sleep and EEG synchrony. Now, while we recognize deep sleep, most of us have heard about deep sleep, and we know that it's important for things like our physical restoration, memory consolidation, and doing things like cleaning out the garbage in our brains at night. In fact, all the non-REM stages are really important to our healthy sleep. The other major state and stage of sleep, and certainly the most interesting, is REM sleep, or rapid eye movement sleep. Now, REM sleep makes up about 20 to 25% of the night, the healthy sleep night. And it's the time of night, of course, when we have our most active and elaborate dream activity. It's also important for several critical functions like memory consolidation, emotion regulation, importantly, and proper brain development, among others. The slide you're looking at here shows a 30-second snippet of rapid eye movement sleep taken from an in-laboratory sleep study, which we also call polysomnography. And REM sleep, in contrast to the other stages, really has unique features in several of the physiological parameters that we measure when people come sleep in the laboratory. So looking at each of these in turn, if we start at the bottom tracing number 5, which represents the EMG, or muscle activity. During REM sleep, the voluntary muscles of our body, so like our arms and our legs, they're paralyzed, so we can't act out our dreams. But fortunately, involuntary muscles like our diaphragm, they do continue to work so that we can breathe. The middle two tracings 3 and 4 here, are the EEG, or electroencephalogram. And during REM sleep, our brain waves actually look similar to what they look like when we're in that light stage N1 sleep. So contrary to often popular belief, REM sleep is not a deep stage of sleep, but in fact, it's a relatively light stage of sleep from which we can be relatively easily awakened. And finally, if you look at the top two traces 1 and 2 here, This is where REM sleep gets its name. This is EOG, or the electrooculagram. And just like the name of the sleep stage suggests, here you can see the so-called REM eye movements, rapid eye movements, which are constituted by eyes that are literally darting underneath the eyelid, followed by kind of periods of quiet. This is a very active 30-second snippet of eye movement activity, but you can see these bursts of eye movement activity followed by sort of periods of quiet and bursts of eye movement activity again. So that's the various sleep stages. Now, this slide shows the organization of a night of healthy sleep, which we call sleep architecture because it resembles buildings on a skyline. So just to orient you to this figure, you can see the sleep stages on the y-axis, stages 1, in this case awake, and stages 1 through 4, using kind of the old nomenclature. And on the x-axis, we've got hours of sleep going from just getting into bed, say, through 8 hours of sleep. Now, there are several organized principles that occur in human sleep that are shown in this picture, and I'm going to highlight each of them in turn. So the first important principle is that we enter sleep through non-rapid eye movement sleep, not through REM sleep, but through non-rapid eye movement sleep. So you can see here, we start awake, then we go into these non-REM stages, and later on, we have rapid eye movement sleep. The second important principle is that we don't fall asleep and just sleep deeper and deeper as the night goes on. In fact, we sleep in cycles throughout the night. And a cycle is from the time, in this case, of falling asleep to the last time that rapid eye movement sleep occurs. Each cycle is roughly 90 minutes in length, give or take. And so in this particular night, you can see 1, 2, 3, 4, 5 cycles of sleep. And the final important principle that really helps us in the clinic a lot about the organization of sleep is that deep sleep, or non-REM sleep, or stage N3, tends to predominate in the first third to half of the night. Then it drops out as the night goes on. So we get most of our deep sleep at the beginning of the night. REM sleep, by contrast, although we do have it at the beginning of the night, it tends to predominate toward the end of the night into the morning hours. So that the episodes become more frequent and longer as the night goes on with respect to REM sleep. So this is why I'm sure that you've all had the experience of waking up out of a dream. That's because REM sleep is most common during that time of the night. Now, while these fundamental principles of human sleep hold throughout the lifespan, there are also multiple changes in sleep that occur naturally in both healthy sleepers and unhealthy sleepers as we get older. And these changes are summarized in this slide, with the figure on the left summarizing the results from a big meta-analysis that summarized the changes in the different sleep stages that occur from childhood, age 5 here in this case, to older adulthood, age 85. And if we focus specifically on adulthood, starting at around age 40, the biggest changes in sleep are summarized in the bullet points. So the first thing we see is we see a very large decrease in deep, slow wave sleep that actually tends to be greater and more precipitous in men. And consequently, we see an increase in lighter stage 1 sleep and wakefulness. So these things occur naturally, even in healthy sleepers. Sleep also tends to become more fragmented, more disrupted as we get older. And finally, there's a smaller but noticeable decline in the amount of REM sleep that we get in relation to our total sleep time. So the percentage of REM sleep that occurs with sleep changes, but it's a smaller change than is typical for slow wave or deep sleep. And these changes are emphasized in the pie charts on the right, which compare the proportions of the different sleep stages on a typical night for a 25-year-old on the left and a 65-year-old on the right. Again, you can see the very pronounced decrease in deep sleep. That's the purple color, where in the 25-year-old, it's quite prominent. And then you see a precipitous drop in the 65-year-old. And again, consequently, you see an increase in both wakefulness and light stage N1 sleep in the older individual compared to the 25-year-old. So those are natural age-related changes that occur in everybody across the lifespan. Now, in addition to the changes in sleep stages that occur with age, there's also fundamental changes to what's considered healthy sleep duration. Now, this is a slide that's taken from the National Sleep Foundation, and it lists recommended sleep durations from newborns through older adults. This is a different slide than you saw last week with Dr. Shulgakar, but it maps on to the same information that you saw last week. So just to remind you, as you can see, sleep need is quite high in the early part of life. Newborns, infants, and toddlers need anywhere from 12 to 17 hours of sleep. But it levels off during teenage years, and then it's relatively stable through adulthood. You can see ranging from a recommended amount of 7 to 9 through most of adulthood. But it's important to note that while 7 to 8 or 9 hours is what's typically recommended, there's a wide range around that number, ranging from as low as 6 to as high as 11 hours of sleep. So this means that there are definitely people who need fewer than 7 hours of sleep at night to be healthy, but there are also people who need more than 9 hours of sleep to optimize their health. So it's really important to understand what your own sleep duration needs are. And in fact, we don't have any direct measure like a blood test or a biological marker that can tell us if somebody's actually getting enough sleep at nighttime. So we instead determine it indirectly based on how they're functioning during the daytime. And that really leads me to my last slide in this section, which highlights that while we're almost conditioned to think about the number of hours of sleep at nighttime, healthy sleep is about more than just how many hours of sleep somebody gets. Just like our own health is a multidimensional concept, we've really come to think of healthy sleep as also being multidimensional. And sleep health focuses on different measurable characteristics of sleep that are associated with optimal physical and mental health and optimal daytime functioning. So if you focus in on the dimensions in the middle of this figure, apart from duration, which we've already talked about, the 6 dimensions of sleep health include the timing of sleep, that is the placement of sleep in the 24-hour sleep cycle and how that aligns with somebody's internal circadian rhythm. We mentioned the word chronotype previously, how that aligns with one's chronotype. Another important dimension is the regularity of sleep, and that is the consistency of sleep and wake patterns across days and over time. Sleep-related daytime functioning is another important dimension. That's how well somebody's able to function during the day in key areas like alertness, cognition, and mood. Satisfaction describes someone's perception of how good and restorative their sleep is. And the final important healthy sleep dimension is continuity. And continuity is how sustained somebody's sleep is at night, how easily they can fall asleep and stay asleep at nighttime. So the notion is that in order to really optimize your physical and mental health, it's critical and crucial to pay attention to all of these dimensions of sleep health. So what happens when we don't do that? So let's turn our attention for the next few minutes to discussing what happens when sleep health is not optimized. And I think most of us can appreciate that the next day main observable consequences fall along one of these particular areas. So we can feel sleepy and or fatigued during the day. We can also have difficulty with our thinking abilities in some way. So it may be harder to pay attention, might be harder to concentrate. We may have difficulties with memory. And we can also experience significant mood changes when we don't sleep well, such as feeling more irritable, feeling more on edge, or even more sad and depressed or more anxious and overwhelmed. These are all common consequences of unhealthy sleep at nighttime. But of course, the consequences are much broader and more widespread than these. Since healthy sleep plays a significant role in almost every system in the body, it stands to reason unhealthy sleep will increase risks in all of these systems. And indeed, we have lots of research that consistently finds that inadequate or unhealthy sleep increases things like pain sensitivity and intensity. It interferes with the body's natural daily rhythms that regulate hormones like cortisol and melatonin, and hormones related to appetite, stress, and growth. Unhealthy sleep increases the risk for medical disorders like obesity, diabetes, and cardiovascular disease. It weakens our immune system by reducing antibody production and by increasing inflammation. And importantly, it increases our risk for mental health disorders like depression, anxiety, and substance use disorders. Now, one of the most dangerous but under-recognized consequences of unhealthy sleep is actually drowsy driving. In fact, drowsy driving is responsible for 1.2 million crashes each year and 5,000 to 8,000 road deaths, which is nearly twice the number of deaths caused by distracted driving. So drowsy driving is often referred to as the 4D among drunk, drugged, and distracted causes of impaired driving. The risk of drowsy driving crashes is heightened after a poor night of sleep, but many people underappreciate how impaired they are behind the wheel after inadequate sleep. As you can hopefully appreciate from the video I just started playing, it only takes 4 seconds to run off the road and crash your car. So it's really imperative people are aware of the safety concern while driving. They do their best to get adequate sleep before driving, and they stop driving if they feel drowsy behind the wheel. Now, one approach that's been taken by many research groups to highlight the adverse daytime consequences of unhealthy sleep has been to equate performance following sleep loss to performance following alcohol consumption, which is a substance we, of course, recognize that clearly impairs performance. Using laboratory and simulated driving tests to measure performance, These studies have consistently found that performance following 17 hours of wakefulness is equivalent to performance at a breath alcohol concentration of 0.05% BAC, which is the equivalent of about 3 to 4 standard drinks. And performance after a full 24 hours of wakefulness is the same as performance following 5 to 7 standard drinks. Other studies have found people with moderate to severe sleep apnea, which you'll hear about next week, perform worse than people with a blood alcohol concentration of 0.06 or 4 to 5 standard drinks. And finally, the effects of insufficient sleep and alcohol are synergistic, so that one beer can have the impact of 6 beers if someone's only obtained 4 hours of sleep the night before. So taken together, all the research to date supports the importance of healthy sleep for optimizing both our physical and mental well-being. So how do you know if your sleep is healthy? Well, one way to assess if you're getting adequate and healthy sleep is to evaluate how sleepy you feel during the day. As I mentioned earlier, if your sleep is healthy, you should feel awake and alert during the day. Now, the most widely used measure of daytime sleepiness is called the Epworth Sleepiness Scale. You're looking at it here. And this scale asks people to respond how likely it would be to doze off in different situations under normal circumstances. Some of these are sleep-inducing, others not. And they rate each situation on a scale from 0, which is would never doze, all the way up to 3, which is a high chance of dozing. So I'm going to take a second to read through each of these situations. And as I do, I'd ask you to rate how likely you'd be to fall asleep in these different situations. Using the scale, 0 is would never doze, 1 is a slight chance, 2 a moderate chance, and 3 a high chance of dozing. Okay, situation 1 is sitting and reading. Number 2 is watching television. 3 is sitting inactive in a public place. 4 is as a passenger in a car for an hour without a break. 5, lying down to rest in the afternoon. 6 is sitting and talking to someone. 7, sitting quietly after lunch without alcohol. And number 8, in a car while stopped in traffic. So take a second to add up your score. The score should range from 0 to 24. If your score is less than 0 or greater than 24, I recommend you redo your addition. So here's the results from a population-based study to help you compare your score. For reference, a score of 10 or higher is considered to be significant and consistent with excessive daytime sleepiness. As you can see from the results of this study, 20% of subjects scored higher than 10. Subjects with moderate sleep apnea scored on average 11.5. Those with severe sleep apnea scored on average 16. And subjects with diagnosed narcolepsy in this study, which is a sleep disorder associated with significant sleepiness, scored on average 17.3. So you can determine where you fall on this gradient. So now that I've talked about the fundamental concepts associated with healthy sleep and highlighted the consequences of unhealthy sleep, I want to now turn it over to my colleague, Dr. Greta Ragland, for the remainder of this talk to describe some specific and concrete challenges for you to obtain consistently healthy sleep.
Thanks so much, Todd. Give me just a second here to pull up my slides so you all can see what I'm seeing. And I just need to put it in the correct format. Good, thanks, Todd. All right, well, thank you all so much for being here today. It's really a pleasure to be here with you all. So as Dr. Arnott mentioned, I'm going to address some strategies tonight that will help you get better quality sleep or maintain good quality sleep that you're already achieving. But before diving into that, I would just like to say that these are strategies that are not alternatives to quality interventions for specific sleep disorders. So if you think you have a sleep disorder, we do encourage you to contact your doctor. And if you need more information about disordered sleep, please log in next week when I and our colleague Tyler Grove will be discussing disordered sleep and specific sleep disorders and treatments that may be helpful for those specific sleep disorders. So our first kind of key to good quality sleep is something called sleep hygiene. Now, practicing sleep hygiene is not a cure for something like insomnia, for instance, but it is necessary for improving overall sleep and maintaining good quality sleep. Sleep hygiene is really focusing on behavioral and environmental factors that have been shown to interfere with sleep, and practicing good sleep hygiene encourages kind of sleep positive behaviors. The goal of sleep hygiene overall is to reduce arousal or agitation at nighttime, which then helps to set the right conditions for sleep to occur rather than actually making you fall asleep. I'm going to go through sort of the main targets for sleep hygiene, which you can see here on our ladder down to sleep. So the first of these kind of main targets is maintaining consistent, regular signals to the internal clock. And this means implementing strategies that help sustain your internal circadian rhythm, including keeping a regular bedtime and wake time, keeping meal times consistent during the day, and engaging in activities like exercise at regular times during the day so that your body can really predict when to be awake, when to be asleep, and when certain activities of the day might occur. Next, we want to think about reducing substances that interfere with sleep. In particular, substances like caffeine and nicotine tend to make it harder for us to sleep. They increase our sense of wakefulness. So we really want to avoid these close to bedtime. Now, caffeine in particular stays in our body for a pretty long time. The half-life of caffeine is up to 8 hours. So we recommend no caffeine in the afternoon in order to keep it out of our system close to bedtime. Now, substances like alcohol and cannabis can also negatively impact sleep, especially kind of impacting the sleep architecture that Dr. Arnott was describing, which makes sleep less restful and poorer quality. So also avoid these before bed. We also want to avoid daytime behaviors that might interfere with sleep, such as exercising too close to bedtime, which can actually increase our body temperature and make it harder to sleep. We also want to reduce light exposure prior to bedtime so that our body can continue to produce adequate melatonin to get us to sleep and keep us asleep overnight. And as Dr. Arnott mentioned in the poll question, light exposure, especially in the evening, tends to reduce our body's production of melatonin, which then makes it harder for us to fall asleep and stay asleep. You can see here that typically the body begins producing melatonin from the pineal gland in the evening. Melatonin peaks in the middle of the night when we're actually already asleep and kind of helps sustain sleep through the night. And then melatonin drops off in the morning. So if we're exposing ourselves to too much light right before we go to bed, we tend to have a more difficult time falling asleep and staying asleep. Next on this list of things to engage in for sleep hygiene, we want to make sure that your bedroom environment is ideal for sleep. This usually means that it is cool, dark, quiet, and comfortable. So think about ways that you might be able to achieve this in your current sleeping space. A mattress topper might improve the comfort of your bed, for instance, or an eye mask might be helpful to reduce the impact of street lights. Sometimes white noise can help to reduce the impact of unexpected sounds on your sleep, and a fan can kind of serve the dual purpose of cooling your sleeping space and providing white noise. This is an opportunity to really get creative about what might be impacting your sleep in your sleeping environment and trying to find solutions to those problems. Again, the big things that we're looking for are that your sleeping environment is cool, dark, quiet, and comfortable. So anything that you can do to improve those factors are going to make sure that your sleep environment is as sleep friendly as possible. And then lastly, we really encourage you to set a pre-bedtime wind down routine in the last 45 to 60 minutes before you go to bed. During this time, it's an opportunity for you to dim your lights in order to get that melatonin production activated, and keep them as low as possible so you can continue to engage in activities but don't need any extra light. The activities that you're doing during this last 45 to 60 minutes before bedtime should be pleasant, quiet, relaxing activities, and you should avoid activities that might make you feel more activated or alert during this time or might make you feel agitated. This is also a great time to have a small snack in order to avoid having hunger wake you up overnight, and also to cue your body that it's getting close to bedtime. The second key to good quality sleep is to optimize your current sleep schedule. Now, as I mentioned before, keeping regular, consistent schedules is really important, but that alone is not sufficient. So schedules really need to be aligned with your brain's internal schedule. And in the chat, many of you put whether you're a morning lark or a night owl. And so trying to line your sleep schedule up with your body's internal rhythm helps to allow you to fall asleep and stay asleep more easily than if you're trying to sleep outside of your body's preferential sleep time. Now, the other important consideration in optimizing sleep scheduling is how much time you actually devote to sleep each night. So your time in bed should actually be roughly equivalent to the amount of time that you actually sleep each night, rather than having excessive time spent awake in bed over the course of the night. So this way, you're really maximizing the efficiency of your sleep, which is one really important element of sleep health. I'm going to go through this figure a little bit with you to talk you through the process. So essentially, if we look at this person's baseline sleep here, we can see that there are periods of both wakefulness and sleep during the night, and that the sleep is not solid, but is broken up throughout the night. People often try to spend more time in bed in order to increase their opportunity to get more sleep, but this really more often leads to more fragmented sleep that is spread across the night as opposed to a truly greater amount of sleep. So typically people will kind of max out their total sleep, but just have it spread out over the night. Instead, I recommend determining how much sleep you're actually getting each night on average, and then spending about that amount of time in bed each night. So if you're actually sleeping only 7 hours, you really only need to be in bed for 7 hours. This may require you to go to bed later or get up earlier than you're used to, but it can really help to retrain the body to get all of that sleep in larger chunks, which leads to more restful sleep overall and better quality sleep in the long run. Now, sometimes people will find that when they do this, they're not getting a full night of sleep, or they wake up still feeling tired or like they could use a little bit more sleep. In that case, sometimes we will have people gradually increase the amount of time that they're spending in bed once their sleep is well consolidated and consistent. What we're really looking for is not a specific number of hours of sleep to show that you're sleeping well, but rather that you're feeling rested and able to function well during the day. Now, the third key of good quality sleep is to engage in sleep compatible behaviors. There are a lot of these, but I'm going to summarize some of the most important points here. So firstly, having a consistent wake time. You can see that this is really important because it's the third time I'm mentioning it, but having a consistent wake time serves as perhaps the strongest wake signal that you can send to your circadian clock each day. And if you maintain that even on nights when you've had a poor night of sleep, it really helps your body to predict when you should be awake, and also allows your body to be ready to sleep at bedtime. So again, this kind of sets an anchor point for your day so that you're maximizing the signals of wakefulness to your body at that wake time each day. Next, lie down in bed only when you're actually really sleepy. This means don't go to bed if you're not sleepy, and also get out of bed during the night if you can't sleep. So if your bedtime rolls around and you're still feeling wide awake, it's actually better to stay out of bed until you feel like you're ready to go to sleep. This maximizes the chances of falling asleep quickly and sleeping efficiently or solidly through the night. So even though it might sort of feel like you're going to bed a little bit later, you're probably going to get better quality sleep if you pay attention to your body's sleepiness signals. We also encourage you to use the bed for sleep and sex only. It should not be used for non-sleep activities like reading, watching TV, looking at screens, etc. The bed should really be for sex and sleep only, as that helps you to build an association between the bed and sleeping so that your body predicts that that is a place for sleep and is more likely to experience sleepiness and ease of going to sleep when in bed. And we had a few questions about naps, and we'll talk about this maybe in a little bit more detail later. But our general advice is don't take naps, especially if you have any concerns about insomnia or inconsistent sleep. No matter how poorly you slept the night before, avoiding a nap really helps to keep you from stealing sleep away from the next night. So if you nap during the day, you're much more likely to have disturbed sleep or difficulty falling asleep the next night. So keeping awake all day will help set you up for better quality sleep at night. Now, you might be wondering, why are these specific principles so important? And the first thing is that you cannot force yourself to sleep. Unfortunately, the harder you try, the harder sleep is. You really have no control over whether or not you sleep, and you can't make your body fall asleep quickly. The only thing that you really have control over are the conditions that you set up for sleep, and how you respond when you don't sleep. So if you're responding with increased agitation, worry, or fear, then you're less likely to fall asleep. Whereas if you respond by engaging in behaviors like relaxation, you're much more likely to sleep. This means that laying in bed and trying to sleep is going to work against you and actually leave you more frustrated and probably with less sleep overall. Now, secondly, consistency is the key here. And it's been reiterated on all of these slides, but the more consistent you are, the easier it is for your brain and body to learn associations, for instance, between the bed and sleep. And thirdly, if you remain in bed when you're not actually sleeping, you're much more likely to experience broken sleep. And so if you have kind of this experience of broken sleep and you're not getting out of bed, it's going to be harder to sleep the next night. And so these recommendations really kind of help your body to understand the clear distinction between wake and sleep and allow you to get better quality sleep when you do. Okay. Now, the fourth kind of key to good quality sleep is reducing stress and agitation that can interfere with sleep. Stress and cognitive activation can make it more difficult to fall asleep or return to sleep if you're awake overnight. And arousal can manifest during the sleep period as physical tension, mental arousal, or both. And there are a number of techniques that have been found to be helpful in targeting this kind of arousal or agitation that interferes with sleep. Now, one example is to kind of get worry out of the way during the day rather than experiencing it kind of flooding in at nighttime. So one of the ways to do this is to engage in something that we call constructive worry, which is focusing on specific concerns and potential next steps to resolve those worries. So this is sort of like a amplified to-do list where you write down a couple of things that are concerning you or that you know might come up in your thoughts at bedtime, and then thinking about kind of tangible next steps to address them. This is something that you would do during the day so that it's not activating all of these thoughts right before you go to bed. In other cases, you might have to address unhelpful thoughts that contribute to negative emotions or interfere with sleep. So this can be accomplished by identifying the thoughts that relate to the negative emotions, examining them critically for unhelpful thinking patterns, and then working to change them so that your thinking is a little bit more balanced and accurate or helpful. So an example here is, a thought that might occur when somebody's having difficulty falling asleep is, if I don't fall asleep, I won't be able to function at work tomorrow. Now, an alternative to that thought is, I have actually functioned fine before or after a bad night of, I've actually functioned fine after a bad night of sleep. And so if we can reframe our thoughts into something a little bit more helpful or kind of less catastrophic, we tend to feel a little bit more relaxed and we're more able to sleep well. Finally, there are several types of exercises, including different forms of relaxation and mindfulness-based meditation that you can learn to reduce arousal and cultivate a present focus, which is very helpful for encouraging good quality sleep. And the final sort of key to good quality sleep is trying to keep a good balance in both sleep and daily life. So the way that we do this with regard to sleep is focusing on the sleep that you are getting and what you can control, as opposed to the sleep that you missed out on or the things that you can't control. Never try to sleep, and accept that insomnia or sleep disruptions can be a normal response to stressors. Try to maintain realistic expectations about your sleep and avoid kind of those catastrophizing or overly negative thoughts that might make you feel worse about your sleep and contribute to that arousal at bedtime. And then in daily life, we want you to remember to schedule time each day to practice self-care. This helps to reduce that sense of agitation or arousal at bedtime. Find positive strategies to manage stress and anxiety, and connect with social and emotional supports often. Practicing self-compassion and present focus engagement helps to kind of keep your mind in a good state to address some of these concerns that can come up with regard to sleep. Now, finally, I do want to just reiterate, there are times when you might want to see your doctor about your sleep concerns. Next week, Dr. Grove and I will be discussing more specific sleep disorders in a lot of detail, as well as treatments that go along with those sleep disorders. But if you are experiencing any of these symptoms, I would highly encourage you to seek out your medical team. These involve kind of persistent difficulty falling or staying asleep, snoring, choking, or gasping in your sleep, if somebody has ever told you that they've seen you stop breathing in your sleep, or if you have kind of a creepy crawly sensation in your legs or the need to walk or move your legs in the evening. And if you sleep really long hours but never really seem to feel rested, those would all be indications to seek out some medical care to make sure that there's not a sleep disorder that you're missing. So our take-home messages from today are that sleep is an active process when the brain recovers and reorganizes, and all of the stages are important to getting good quality sleep. Lack of sleep affects brain functioning, mood, personality, and work performance across kind of a spectrum of parts of our body and brain. And improving sleep might be kind of the first step in your path to health and wellness, and can also be an excellent way to improve health, even in areas that seem unrelated to sleep. There are lots of strategies that you can use to improve your sleep, and if you need additional assistance, you can always reach out to your medical team.
Great. Thank you both so much. And thank you also for answering some of the questions written out. You can, participants, if you go into the Q&A, you can toggle to the answered section where both Dr. Ragland and Dr. Arnott have been answering your questions as we've been going along. So we're going to jump right in. Again, we received a number of questions in advance, a number of questions live tonight. So we might not be able to get to them all, but we're really excited to dig in here. Dr. Arnott, you shared the risks in all systems from unhealthy sleep, and we received several questions in the chat related to poor sleep quality and dementia. Is there a link there? And if so, what's more important, quality or quantity, and any particular sleep stage more important?
That's a good question. And we do, the short answer is we don't know the answers to that yet. We do know that there is an association between sleep and dementia. And as I mentioned when I was talking about the purposes or the functions of especially deep sleep, one of the functions of deep sleep is to sort of clean out that garbage in the brain. And we think that that might have relevance to what goes on in people who go on to develop dementia. And it's a deep sleep, or the deep sleep doesn't occur as it dissipates. It doesn't. The brain no longer gets cleaned out by sleep at nighttime, and so that may be one of the pathways that can contribute to dementia. But we don't know the specific answers yet about what are the mechanisms that lead to it. But certainly we know that there are associations.
Okay. I know you both talked about sleep cycles and architecture, but we had quite a few questions pre-submitted, and now this is probably the second most upvoted question we have about the middle of the night wake up or waking up between cycles of sleep. Is there anything that we can do to minimize waking up between sleep cycles? And I don't know which one of you wants to answer.
I can jump in,
Go for it.
and Dr. Arnott, feel free to add to it. So it is actually kind of normal and natural to have at least a couple of overnight wakenings. And part of that is because the way that our sleep architecture works is that we're kind of going in and out of those deep phases of sleep. We're much more likely to wake up from sleep when we're in the lighter stages of sleep, like stage 1 and 2, because we might be interrupted by things like discomfort or a sound in the house. But the real concern is often falling back to sleep. And so one thing that I really like to encourage people to keep in mind is just because you're awake doesn't mean that there's something wrong with your sleep, as long as you're able to go back to sleep. And I think that one of the ways that we can minimize those overnight wakenings is, like I was discussing in the second half of the presentation, kind of consolidating the amount of time that you're spending in bed. If you're spending a lot of time in bed trying to sleep, you're much more likely to have that fragmented sleep. Whereas if you're kind of keeping your sleep more efficient, staying in bed only for the amount of hours that you really need to sleep, you're much less likely to have that broken sleep overnight.
Okay, that makes sense.
Yeah, I would highlight exactly the same things Dr. Redden did. It's very normal to wake up during the nighttime, and we do not get excited about that in the sleep field. It happens. It's part of normal sleep architecture. There is a limit, though. You can wake up too much. If you are waking up excessively, that may be indicative of something that's wrong with your sleep. But anywhere from 1 to 4 wake ups a night is pretty typical for adults. And as Dr. Ragland emphasized, then the issue is, can you return to sleep? And if you're able to return to sleep in a reasonable period of time, then we would just call that normal sleep.
Okay. Okay, that's great. All right, our next question, again, I'm relying on this upvoting here, is related to, well, and we also got several questions in advance related to device use. And so if someone is trying to read before they fall asleep, hopefully not in bed after listening to your recommendations, do you recommend using a red light book lamp for reading? Something dimmer.
So if you're going to be awake overnight, like for instance, when I'm working with folks who have a newborn at home, for instance, and they're going to be doing activities overnight, like changing diapers, it is great to use a red light, just because that is less likely to inhibit melatonin production. That being said, you don't have to be kind of excessively obsessive about your lighting at nighttime. Use enough light to read your book, and you should be absolutely fine. Just with regard to devices, they do tend to have kind of a brighter, bluer light than our typical, incandescent bulbs. So if you can keep them on the dimmest setting possible and keep them further away from your face, it's going to have less of an impact on your overall sleep.
Okay. Thank you, Dr. Ragland. I'm going to follow up with a question that we received in advance because it's on a similar topic. But what can parents of newborns and other very young children and other caregivers whose schedules do not allow for consistent sleep do to get quality sleep the best they can? I ask as the mother of a toddler.
Well, this is a great question, and again, one that's near and dear to my heart. So I think one of the biggest things is trying to set aside at least 4 hours for good quality sleep each 24-hour period, if possible. I know this can sound a little bit like wishful thinking, especially when somebody has a brand new baby at home or something like that. But that kind of 4-hour chunk seems to be really important for some of the features of sleep that Dr. Arnott was discussing earlier, really getting to all of the phases of sleep and allowing for adequate opportunity for your brain to recover, and kind of file out some of that garbage that we were talking about. And so having that 4-hour chunk of sleep is really important. And I do recommend that people talk with their support network about ways that they might be able to facilitate that, like having a grandparent or a partner or a friend who's able to monitor baby while the other parent is getting that 4 hours of sleep tends to make a really big difference in somebody's overall functioning. The same goes for people who have kind of more challenging schedules that might make it difficult to get that, the complete 8 hours every single night or complete, 7 hours of sleep, but really focusing on making sure that they're getting that one consistent chunk of sleep.
Does that apply also to someone who might be working a night shift or an irregular shift, just being consistent with their sleep?
Yeah, and I would also add that the timing of the sleep, if you
Mhm.
can keep that consistent, that's really helpful. Our circadian system will anchor to things that occur regularly. And so one of the things we often work on with people who work shifts, like rotating shifts and are sleeping sometimes at night and sometimes during the day, is we encourage them to engage in what we call anchor sleep, where you are, whether you're days on or days off, you are overlapping as many hours of your sleep in the 24-hour day as you can, so that your circadian system gets that consistent signal and anchors itself to that time of day, and allows you to sleep better. So the timing of that even if it's limited sleep, if it's consistent timing, that's really helpful.
Okay. We're continuing on this disruption train, but and we've also received several questions related to jet lag. But do you have any advice for jet lag and how to sort of come back for that or control our sleep around jet lag? What to do?
Yeah, jet lag's tough because even the best of sleepers get messed up when they fly across time
Yeah.
zones, right? Our circadian system, it has what we call a range of entrainment, so how far it can move, but it's not very flexible. It has a relatively small range that it can move. So when you fly from here to Europe, you're asking it to move 6 hours all of a sudden. It can't do it that quickly. So you're inevitably going to have difficulties if you don't make any changes ahead of time. Now, some things you can do, and we actually have little charts that we can make up for people if we know where they're flying to, and give them a plan ahead of going to that different place so that they end up having their circadian system in kind of what we call a compromised position. And so these things would include gradually, assuming you're flying eastward, flying to Europe, slowly adjusting your sleep schedule over the course of days before you go in like 30 to 1 hour increments over the course of several days, just to really move your circadian rhythm earlier. You can also use melatonin once you get there, and sometimes also on the plane, and you can use light exposure while you're here to help you kind of move your circadian system to an earlier time. And so that you can do some things before you go, but the reality is that you're likely to still have some disruption once you get there. And our system accommodates to about an hour a day, is what it can tolerate. So if you're flying 6 time zones, it will take roughly 6 to 7 days for you to get accommodated to that new time zone on average. Everybody's a little bit different, but that's kind of the rule of thumb.
And I just also tag on to that, there are going to be trips where it's not even worth making that shift, right? So if you're traveling somewhere for a weekend that's 6 time zones away, you might never really fully get to the time zone of your destination, and then you're going to have to switch back to your home time zone. So sometimes it's just kind of finding a balance where you're operating somewhere between the time zones on those shorter trips.
And Dr. Ragland, I saw that you answered someone's question to daylight saving time, which we had a question about in our first session, and I think it was similar advice, which is the adjusting the 30 minutes a couple days in advance. So that is a great tip. Okay,
Yes.
scrolling through our Q&A for our upvoted questions, I see a lot of questions about melatonin, and I'm going to circle back to, and other supplements, and I'm going to circle back to a pre-submitted question. And I think Dr. Arnott, you wanted to take this one, but the participant would love to hear about the benefits, risks, myths around assisted sleep through over-the-counter medications, prescription supplements, CBD and THC, which is
Yeah,
a
so
lot.
that's a lot. That's a
Yeah.
lot. So let's take them. We'll take them in turn. We'll start with the prescription medication. So prescription medications, obviously ones that your doctor writes you prescriptions for. We actually know a lot about their efficacy and their safety because most of them, at least the ones that are approved for insomnia, which is usually why we're using sleeping medications, have been widely tested in large-scale research studies, and those that are recommended have been shown to be both safe and effective. So those would be things like Ambien, Sonata, Lunesta, the newer ones like Belsomra or Qvivic. These are different mechanisms of actions that the medications have, but these have all been shown to be both safe and effective. By contrast, over-the-counter supplements, while it's alluring to think that, oh, this is over-the-counter, and so it's likely to be safe, we just don't have the same understanding of both either their efficacy or their safety if people take them regularly. Some have been tested, pulled out. Often you'll find these supplements that have combinations of L-theanine and magnesium, and they usually have melatonin. Melatonin is probably the most active ingredient there. But we just don't have a lot of research around a lot of these supplements, except in isolation. So diphenhydramine, for example, has been tested in some controlled studies and shown to have small to no effects when tested in that way for people who have insomnia. Melatonin is an interesting one. You mentioned melatonin in particular, because melatonin does often have some use. I just mentioned it in relation to it being helpful for jet lag. That's one situation where melatonin can be helpful. It can sometimes be helpful for shift workers who are trying to sleep during the daytime because our bodies don't produce melatonin in light, as Dr. Ragland highlighted. And so melatonin, if you want to be sleeping, melatonin can be sedating if you take it when your body's not producing it. So that is during the daytime. And melatonin can also sometimes be helpful for falling asleep. We do know that as we get older, melatonin production declines as we get older. And so there is less melatonin, which means a less robust circadian signal. So sometimes supplemental melatonin, especially for people who have trouble falling asleep, can be helpful, but it's not typically helpful for staying asleep at nighttime. And then finally, cannabis. So of course, there's a lot of excitement and interest about cannabis. And in fact, I think we've all in our clinic have taken to asking every single patient whether or not they use or have used cannabis for sleep. And I would guess 75 to 80. I mean, it's a high percentage of people who are using cannabis for sleep. And the hype is outpacing the science for cannabis. We do have some emerging science on cannabis. Now, cannabis is the broad term, and there are different cannabinoids that are included in cannabis. The most common are THC and CBD. And studies show that acutely, cannabis, typically with THC and CBD, can help you fall asleep, and it increases deep sleep, but it reduces dream sleep. But those effects tend to be short-lived. So we know that with chronic use, just like alcohol and other even prescription medicines, for example, if you take these repeatedly over time, the sedating and sleep stage effects typically wear off, and so they are not helpful if you chronically use them. But there's a lot of interest about cannabis, and there are a lot of different combinations of cannabinoids that are found in these sleep aids. And we just don't know, the few studies that are out there, there are a handful of randomized controlled trials, and they're with different combinations of different amounts of THC, different amounts of CBD, some include CBN. So there's no set of studies that have the same cannabis that's being evaluated. And the ones that have been done show relatively small effects. So I would be cautious about using cannabis for sleep, at least as far as we know, as far as the science goes.
And I would just highlight what Dr. Arnott was saying about kind of short-term versus long-term use of really any of these substances. So most of our even prescription sleep aids are approved for short-term or acute sleep disturbances, right? They're not intended to be used for months and years to manage sleep disturbance. We have better methods of managing insomnia that include behavioral and cognitive strategies. And some of the medications that are used regularly for sleep, especially some of the over-the-counter substances like Benadryl and things like that, have been linked to some poor outcomes in long-term use, like cognitive changes and things like that we really want to be cautious of and encourage people to follow up with their provider if they have kind of long-term sleep disturbance.
Thank you both. So we're almost at the top of the hour, and I think this question is a nice wrap up. And I'm not sure, maybe one or both of you want to take this, but we received a pre-submitted question as well about the solution always seems like one size fits all. Is it really true that what promotes healthy sleep is the same for everyone?
In a word, not exactly. I mean, the fundamental underpinnings of sleep are consistent across people. Everybody has sleep stages. Everybody has a circadian rhythm. The sleep drive system, which we didn't talk about today, that is intact in everybody. So the fundamental systems that characterize sleep are similar for human adults.
Mm.
But as we talked about when we were talking about sleep health, there's a lot of individualization within that spectrum. So some people need less sleep, some people need more sleep. Some people are morning chronotypes, some people are evening chronotypes. Regularity is important for a lot of people, but some people function okay on little sleeps. Other people don't function well on little sleep. So there's a lot of personalization that needs to be done. Even though we use similar principles and similar approaches, there is certainly a lot of individualization that needs to be done in anybody's to obtain healthy sleep.
Okay, great. Dr. Ragland, anything to add?
I'd just add to that, like Dr. Arnott said, everybody's sleep is somewhat different, even though it's often following kind of a universal pattern. And so just honoring a person's individual sleep needs, like when they would prefer to go to sleep, when they'd prefer to wake up, what kind of job they have, and when they might need to be awake for their work, as well as things like, at-home disturbances, children, pets, caretaking responsibilities that might make their sleep look or feel different to them. The other thing that we get asked about a lot is how much sleep you really need. And often people are citing the kind of 8 hours of sleep mark as a goal, when in reality, the range of need for sleep is pretty wide. Really, anywhere from 6 to 10 hours of sleep is pretty normal. And, we don't bat our eyelids at any of those kinds of numbers. So just kind of keeping in mind that a person doesn't necessarily have to strive to get 8 hours of sleep every night or to sleep, from 10 to 6 exactly. In fact, it could be really variable, and that's okay.
Okay, great. Well, thank you. I hope everyone can join me in thanking you both again for for being with us tonight and sharing your time and expertise. I'd like to remind alumni that a recording of tonight's session and additional learning resources will be available on the main course website tomorrow. So I know we didn't get to all the questions, but hopefully the additional learning resources will be able to help answer some of those as well. I'm going to go ahead and share my screen so we can talk about class next week. We hope you all will join us again next Wednesday at 6 p.m. ET. We're going to see Dr. Greta Ragland again. along with Dr. Tyler Grove, and they're going to be exploring what happens when sleep goes wrong and the common sleep disruptions and challenges. And I just want to also highlight that there are still spots available for our in-person field trip, so you can get a little bit more one-on-one time with Dr. Arnott and the other co-director at the Sleep and Circadian Research Lab. We're going to have some sleep-friendly snacks after our tour there, and then a mindfulness session to get us in the right mindset for sleep. So thank you all again for joining us. Thank you, Dr. Ragland and Dr. Arnott, for making tonight possible. And we hope everyone has a wonderful evening or afternoon, and go blue.
Go blue. Thank you.
Yeah.
Thank you so much.
Thank you all. Take care.
See ya.